Hi, everyone. How are you this Tuesday? Whether it's afternoon, morning, or evening, where you are. Fall is in full swing. Have you checked off all the items on your list? Apple picking, leaf sweeping, pumpkin carving. And since it's a respiratory illness season, have you thought about getting that flu shot into patients' arms? I'm Ian. Leveraging my multicultural expertise and specialized training in communication science, I have collaborated with premier healthcare organizations to bridge gaps in health equity. All these fall activities reminds me of my grandma. The company name Ama is inspired by my grandma, a Taiwanese matriarch who faced type 2 diabetes. Her condition worsened due to a lack of effective dialogue with her healthcare providers. It's a personal mission for me to ensure others don't suffer the same. Alongside me in this mission is Dr. Kasha Han Peters. Having spent 3 decades in healthcare, she has revolutionized the field by launching pioneering vaccines and treatments. Passionate about universal healthcare access, Kasha has mentored emerging life science entrepreneurs to ensure that innovative healthcare solutions reach all who need them. Good morning, Kasha.
Hello, nice to be here. Thank you for
Yes,
the invitation.
very happy to see you. Hey, Kasha, do you remember at that recent conference when I was chatting with a professor from the medical school? She was deep into researching vaccine misinformation. What was eye-opening was when she mentioned that 70% of medical students are stumbling upon misinformation during their clinical hours. Can you imagine? Just stepping into the real world of medicine, and they're already navigating a maze of myths and facts.
Oh, I can picture it. Reminds me of my work on introducing vaccines. And the sad part is, everybody on health teams often finds themselves in the same situation.
Exactly. It's like setting sail in turbulent waters without a compass. The end results? Frustrated professionals, suboptimal patient care, and let's not even get started on how it affects team morale.
The waves of misinformation, especially during and after the pandemic, seem unstoppable. So many attempts to shield and guide, but it's like we are patching up holes on a sinking ship.
You're absolutely right. To improve health outcomes, there is an ongoing race to invest in social infrastructure, diving deep into social determinants of health. But what if we use communication science as our guiding star? It's like turning our focus to those small, everyday interactions we have with every patient.
Yeah, steering the big issues through the little moments.
Exactly right. Speaking of special insights, today we're so lucky to have you with us. You're deep in the vaccine development and communication. So tell us, what have you observed lately?
With everything post COVID, I've seen such a hesitancy around vaccines.
Hmm.
It's not just COVID shots, but vaccines in general. Our segmented approach isn't helping either. Everyone is in their own bubble. Researchers do their thing, the media has its breaking news cycles, and clinicians, well, they are just swamped.
I have seen it too. But when the dust settles, where do most people go for clarity?
Surprisingly, it is still health professionals that have the most trust. We need to build on this trust and craft a narrative that resonates with patients. But in med school, they don't exactly offer persuasive communication one on one course. I recall you weaving communication science into clinical steps. Can you tell us about that again?
Absolutely. Let's talk about why patients act the way they do. It boils down to understanding and influencing behavior. The issue isn't that people dismiss science. Instead, they're constantly evaluating health threats and seeking solutions. Patients need validation that the health threat is real before they can seek solutions. So they weigh things like, is the proposed solution effective? And how easily can I integrate this into my life? Their options can range from essential oils and keto diets to cayenne pepper and qigong. And of course, medications and vaccines. Here is a conceptual model to help us better understand a patient's thought process. The protection motivation theory, PMT, is an extension of the reasoned action theory, RAT, which categorizes a person's behavioral intention into 4 categories: what I think, what my important others think, what I think others are doing, and how easy it is for me to do something. The PMT extends the RAT by illustrating that every time you, as a health professional, want to persuade someone to take preventative actions, certain thoughts will pop into their head. The individual will ask themselves, how serious is the threat? How likely is the threat going to hurt me? Is the recommended response effective? Am I able to implement the recommended response? The first 2 thoughts are termed threat appraisal, and the latter 2 are response appraisal. Together, these form a person's intention to take the target action.
So when patients come to professionals, they are comparing our advice against these options, even though they should trust science more given they are seeking out the clinician's opinion?
Exactly. Health professionals still hold a lot of trust. Our challenge is making the best use of our interactions, especially since we encounter objections or misinformation in nearly 70% of patient encounters. Therefore, mastering the art of effective refutation becomes crucial. When we talk about different or opposing opinions, we have to introduce the word refutation. According to Cambridge Dictionary, refutation is the act of saying or proving that a person, statement, opinion, and etc. is wrong or false. Today, we're going to show you how to implement two-sided refutation. Based on empirical evidence in communication science, this is the most effective way to influence a person's behavioral intention. The process starts with acknowledging the patient's health belief, then moves on to addressing aspects that the patient may have overlooked. Finally, it advocates your position as a health professional with supporting arguments. At AMA Health, we use the health coaching model acknowledged by the American Medical Association to incorporate communication science. Here is our AAA framework, along with two-sided refutation in action. The AAA framework is an extension of the health coaching model championed by Dr. Thomas Bodenheimer. We expand on the middle affirm portion. When telling patients what we think, we first affirm what they think or say. Then we link what they say to our opinion by addressing things they may have overlooked. Lastly, we support our arguments with narratives, evidence, or other patient's experience.
Let's flesh this out. Suppose a patient is all about supplements or vaccines, saying, why vaccinate when vitamin C boosts immunity? How would a professional tackle this?
Perfect example. A response might go like, I completely understand valuing natural methods to boost immunity. It's crucial to remember that being healthy and well-nourished is vital. What do you think, Kasia, that I'm doing with the first step?
By saying so, you are affirming the patient, showing that you hear them.
That's right. Then I will say, however, have you considered that even healthy people can get sick and face serious complications? This helps me link to the position I advocate as a health professional.
That sounds good. We just need a way to link the affirmation to our position. What's next?
Good question. My third step is to provide supporting arguments by saying, while vitamin C has its place, it doesn't replace the proven efficacy of vaccines. Research shows that with effective communication, you don't want to leave things to a patient's interpretation. So at the end, I give specific and explicit conclusion by saying, Being in good health is wonderful, but getting vaccinated just adds another layer of protection for you and the community.
So it's about acknowledging their viewpoint, addressing any oversights, and then advocating for the evidence-based approach.
Right on. The key is to acknowledge without immediately dismissing. They've gone through their own evaluation process. Our role is to provide clarity and fill in any gaps in understanding. For instance, if you only acknowledge a patient's concern, but don't counter any misinformation, it's less persuasive than if you had just outright ignored their statement. Based on empirical evidence, here's a visualization to show you the effectiveness of different refutation strategies from the most effective to the least. In the realm of health communication, we have a spectrum of strategies for addressing different opinions. On one end, specifically the far right of our chart, we have what's known as the two-sided refutational strategy. This is the one that we were just talking about, and it holds the highest empirical evidence for persuasiveness. Moving along, we encounter the one-sided message. Here, the health communicator focuses only on delivering their own message without acknowledging the patient's perspective. While this has some moderate efficacy in persuasion, it falls short of the two-sided refutational approach. Finally, we have the two-sided non-refutational strategy. In this case, the health communicator does acknowledge the opposing point of view, but refrains from challenging it. This could be out of a desire to maintain politeness, but the outcome is that it ranks lowest in persuasive effectiveness.
I think it's a bit like shopping. If I'm skeptical about a product and the seller just nods without addressing my concerns, I'd think twice before buying.
Exactly. Acknowledge but do address. Now, here's another example for you. What if a patient asks about the side effects of vaccines, pointing to the listed warnings as proof of harm?
Let's see. I understand your concerns about side effects. This way, I am acknowledging the patient. Then I say, did you know that the package inserts list all reported events during testing, regardless of causality? By saying so, I am linking my response to the position I advocate as a health professional. Then I continue to say, for instance, some vaccines even list teething, which obviously isn't caused by vaccines. Finally, I'll add a specific and explicit conclusion saying, it's about transparency. Only sections like warnings directly correlate with the vaccine. The goal is to inform, not alarm. And we should be safe. There is so much transparency around healthcare, research, and development.
And don't forget that if you don't have any counter-argument available, just say what you advocate without anything else. Because one-sided statements are more effective than two-sided non-refutational strategies. Just remember about the shopping example you mentioned. Conventional approaches like motivational interviewing may fall more into the category of empathetic understanding and listening. But as I often say, it's like having a heart-to-heart conversation. Without a compass or a GPS, it's easy to get lost in the conversation. This makes it time-consuming and maybe not as effective as it could be. By supplementing it with the methodical approach of two-sided refutation, health teams can achieve the best health outcomes for patients of diverse backgrounds. Wow, this dialogue flew by, didn't it? We have covered a lot, but this is just the beginning. We welcome questions from our audience. Here's a question for you all. What is the most pressing communication challenge you want to solve right now? You can turn on the microphone or type in the chat box. And before you post a question, let us know who you are and which organization you're with. Is it communicating with patients of diverse cultural backgrounds? Is it balancing patient-centric care with patient throughput? Or is it training new team members so that they can deliver the level of quality care your patients deserve? Tell us your biggest challenge. We would like to know your thoughts. When you look closely, communication is everywhere in our operations. It is like the oil in a machine. You don't think about it often, but when it's done right, everything runs smoothly. Thank you for being a part of this enlightening journey, using communication science to radically improve health outcomes for all, because everyone has a right to health. Kashan and I promise you will have access to our downloadable resources to boost your team's patient engagement. Scan the QR code on the left to download it today. And if you feel a connection with today's discussion and want to explore how communication science can reinvent your healthcare approach, let's talk more. Schedule a free training session with us by clicking on the QR code on the right. Let's pave the way for an evolution in equitable patient care. Thank you.